David, does it matter if the Supreme Court strikes down the law or upholds it for what you do as a health plan in New York?
Well, it matters because life is going to be a lot easier if we have an individual mandate. I mean, without it, we, in New York, where we already have guaranteed issue, we are having a somewhat of a spiraling premium problem in the individual and small group markets. But if the Supreme Court strikes down the individual mandate, for us, in essence, life will go on as it is already happening. We will still have community rated, a mandatory benefit package in the individual and small group markets, and we will go on. And obviously, there may need to be efforts to figure out how to stabilize premiums in that market in the absence of an individual mandate. But again, without it, we will be where we are, even though it would be preferable for it to continue.
And if the law is upheld, at this point, not everyone, but certain states are moving forward more quickly than other states. If the law is upheld, where do you go as a health plan?
Well, I mean, we compete in every marketplace: Medicare, Medicaid, large group commercial, small group commercial, individual commercial. We will move into the new world of exchanges in the individual and small group markets. I think it will improve that market. It will make marketing, I think, somewhat less expensive. We expect to be able to compete effectively in an exchange market as we compete effectively today in a more disorganized marketplace for individual and small group. So, we are moving to improve our direct-to-consumer capabilities to make sure that we have, the kind of consumer-friendly website that attracts people and makes it easy for them to buy individual. Most health plans their major focus has been on selling to employers. The world of exchanges is one in which you need to be able to market to individuals and do so effectively, a certain level of disintermediation in that market. And I think that's a good thing. I mean, ultimately maybe that's where we're headed generally, is a much less group coverage and more individual coverage if the exchanges actually were to work, but that still remains to be seen.
So New York is making some changes when it comes to Medicaid. Could you just briefly describe where New York is headed in Medicaid?
Sure. We have a market that is dominated for the regular Medicaid members by managed care. There is virtually no, individual fee-for-service managed care, non-managed care Medicaid left. The state is moving to take even the populations that heretofore were not thought suitable for managed care, such as the behavioral health populations, and moving them into managed care. It is creating a new kind of health home for those people, particularly the most, challenging populations to manage. It has imposed an overall cap on Medicaid spending, and for the most part we have successfully, as health plans and the state and providers together, have been able to stay under that cap. So the negative consequences of piercing the cap have not actually been felt. We had a good process called a Medicaid redesign team that brought all the stakeholders, providers, health plans, state, advocates together to work on redesigning Medicaid in the state, and we're now busily implementing it.
And if the law is upheld and there's an influx of new Medicaid enrollees in New York, is that expected to affect the cap, or how will that affect the Medicaid redesign?
Well, presumably the cap has to be adjusted to take into account, new large numbers of beneficiaries. But again, EmblemHealth has 250,000 or so Medicaid beneficiaries already, and as we've successfully competed to attract those individuals to our plan, and by the way, that's a form of individual sales in both Medicare and Medicaid that gives us a lot of confidence that we can be successful in the new small group and individual commercial markets of selling to individuals, because we have that experience. So, for us, we look on it as a good thing. I guess presuming that the rates are sufficient to the task. But you know, that's a change that we are working very, very hard on and getting ready for, in the expectation that a significant number of those new Medicaid beneficiaries will come to EmblemHealth.